Causes of the hypercalcemia. So firstly, looking at the parathyroid causes. In case of the parathyroid related causes, there is the primary hyperparathyroidism. In case of the primary hyperparathyroidism, this includes the adenomas, includes the multiple endocrine neoplasia as well as the carcinoma. Next, after this, there is also the lithium therapy and the familial hypocalciuric hypercalcemia. Next, we are looking at the malignancy related causes. So now the malignancy related, there can be presence of the solid tumor, and this solid tumor is along with the metastasis and mainly the breast. Next, we are looking at the solid tumors, and this is with the humoral mediation of hypercalcemia, and this mainly involves the lung and the kidney. Next, looking at the hematological malignancies. Case of the hematological malignancies, it involves the multiple myeloma, involves the lymphoma as well as the leukemia. Now, looking at the vitamin D related. So in case of the vitamin D related, it involves the vitamin D intoxication. Case of vitamin D intoxication, this involves the increase in the 125 OH2D, and this includes the sarcoidosis as well as the granulomatous disease. Then it also involves the presence of the impaired 125 OH2D metabolism, and this is due to the 25 hydroxylase deficiency. Now, looking at the vitamin D deficiency and what is associated with the high bone turnover. So in such cases, it can be due to the hyperthyroidism as well as the immobilization, the thiazides, the vitamin D intoxication as well as the fat necrosis. Next, looking at what is associated with the renal failure. So in case of the renal failure, it can include the severe secondary hyperparathyroidism as well as it can include the aluminum intoxication as well as the milk alkali syndrome.